Involuntary treatment refers to medical procedures undertaken without the consent of the person being treated. In 1975, the world finally got a peek into this traumatic experience through the award-winning feature film One Flew Over the Cuckoo's Nest.
What's that?
Conducting.
A little dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it. That's right. Just bite down.
Huh?
Now bite down on it.
Are you ready? Here we go.
Involuntary psychiatric treatment has become standard protocol in every hospital emergency department in the developed world. Very few people witness involuntary treatment firsthand, aside from healthcare professionals administering it and psychiatric survivors who have lived the experience.
The night before my college graduation, I was very nervous and stressed out. My family was there, and I don't always get along with them. And I ended up doubling my dose of Xanax.
Basically, I was under a lot of pressure at school. I imagine it's my mother's panic that put me in the hospital. What do we do about him? He's obviously off the wall or something.
I lost my boyfriend. You know, he broke up with me, and a lot of feelings were coming up for me.
I ended up not sleeping for weeks at a time, and by the end of September, I was hallucinating.
I started seeing like these visuals, like these buildings, and I don't know, it's kind of weird, but it was a euphoric feeling.
Slowly, day by day, I kind of entered into an alternate universe, an alternate world. And then finally, in public, I started acting in a way that people thought something was abnormal or something was wrong.
General practitioner gave me the baclofen and prednisone. Both drugs can cause psychosis.
I go to the hospital to have my baby, and I'm a very long time in labour, and because I'm in the labour for so long, I'm given this pain reliever, which is called nitrous oxide. So here I am now, and I'm taking this gas all the time, and I'm changing personality all the time, really changing in personality. Then they perceive me to be in a mind, to be gone a bit crazy. And you must remember, all this time, my future child was in my womb.
I had just moved 3,000 miles from Oregon to Massachusetts. I had a lot of unresolved traumas, including abusive basketball coaches and my parents being divorced. And I was in a really bad relationship. Things just kind of spiraled out of control, thinking that I was going to quit grad school after a week and convince myself that I could fly my car.
Laws vary by state and country, but involuntary treatment typically begins when a doctor declares a person to be a danger to themselves or a danger to others. Most people who are involuntarily treated have never committed a crime, specifically a violent crime. And doctors deem 95% of them a risk to themselves, not to others. And being a risk to oneself is far more ambiguous than having suicidal thoughts. In most places, the legal qualification of being a danger to oneself is expanded to include people deemed unable to care for themselves, described as gravely disabled. In many cases, well-intentioned family members have brought their loved ones to hospitals and exaggerated their situation to make sure they get committed.
My mother and I were arguing, and finally I gave up because she just was determined that I was going to go in the hospital.
My boyfriend at the time called the cops.
The police came, they walked into my home without me letting them in. They came into my home. They basically removed me forcibly from my house, brought me to the local jail, and then brought me to the hospital.
Once a person has been involuntarily committed to a hospital, a separate process usually regulates forced drugging. But even without a court order or prior approval, medical professionals commonly restrain and inject individuals with drugs to control undesired behavior.
Somebody's will is imposed over yours, and your integrity, your body, your physical integrity is also being violated.
I guess I was yelling and screaming, and I wasn't like cooperative. I wasn't hurting anybody. They put their hands on me first, and I just reacted. I felt the needle go in, and then I woke up in a psych ward.
Basically, as a seclusion room, or functions as that. I was locked there for about 10 hours. And I said, no, I'm not actively suicidal. I'm not going to go do anything. I just wish I could get hit by a car or something. And at that point, he literally said, that's it. You can go either voluntarily or involuntarily, which is funny because neither of those options are voluntary.
I didn't have an expectation of what was going to go down because, I didn't even know I was going into a hospital. Once entering in there, it was like landing on a different planet.
They brought in a bunch of orderlies, took me to a room, tied me down, and shot me up with stuff. I can't tell you what it was. I remember asking a nurse, what am I supposed to do now? She's like, just sleep.
They dragged me upstairs to the women's ward. They just injected me with a lot of Thorazine. I have no idea how much, just a ton of Thorazine. So much that I passed out. And then they put me in seclusion. And they didn't say, you are now being entered into the hospital or anything like that.
When I was brought to the hospital, they assessed that I was suicidal and that I was gravely disabled. Granted, I was speaking about suicide. I was saying, please do not drug me. Please do not put me back in the hospital because they are going to torture me. I would rather kill myself than go back to the hospital.
They gave me medicines right away. I think the medicines had some kind of effect on me. Like I was very drowsy and felt like a zombie. And I thought that was part of my disorder. I thought that was my disease, like feeling like a zombie. I didn't know it was the medications.
They let me breastfeed, give me more drugs, and then they considered after 2 days that I need to go to a psychiatric hospital.
Once an involuntary commitment begins, the circumstance tends to worsen any emotional distress the individual is experiencing, which then amplifies their outbursts and causes medical staff to respond in an amplified manner.
I need to change my tampon.
I don't understand, but the nurse say no.
Okay, well, tell the nurse yes. I need to change my tampon.
Les infirmières, je fais juste vous aviser qu'elle gosse, là. Oh, elle a enlevé.
Elle a enlevé.
Elle a enlevé.
Non.
Oh, my God, tu peux te...
Elle a enlevé quoi?
It included a forced catheterization, and it totally, completely traumatized me. It was like rape.
And I wake up in a different hospital, which is another trick. Like, if you're going to really disorient somebody, tie them down, shoot them up with stuff, and then transport them to another hospital before they wake up.
Just having my bodily autonomy completely taken away, completely removed from me.
You know what it's like here? This is a prison. I don't know any locked wards that have ever been houses of healing.
As soon as I was in that place, I wanted to leave. They were saying, you need to take this drug for this so-called condition for the rest of your life. But definitely you have to take it right now. It became very clear that if I didn't, I was going to be forced.
I was really shattered. It was very traumatic.
It didn't matter who I was or what was happening for me. It mattered whether or not I was under control, according to the hospital.
There's something essentially dehumanizing about that. And I think it's for the same reason that rape is a violation.
I just couldn't believe that anybody could do that to someone.
I knew it was really bad to separate mother and child, and I was crying out to be with her. That longing is always there. And for people who are separated, from mothers and children who are separated, I feel it so strongly.
The experience of being locked up and incarcerated was so much worse than any of the drugs that I took.
Injecting me against my will is torture, and that's really what it comes down to, is that we cannot continue to be torturing people in this day and age.
Involuntary commitment and forced drugging continue until a doctor determines the individual is fit to return to the community, with the individual having no idea when it will end or if it ever will.
I started asking people, like, what's going on? Is there something wrong with me? When do I get out of here? And one of the patients said, you might never come out of here. Like, this other guy has been here for years. I started freaking out.
I was in a hospital for about a month.
Like 3 months at a time.
And then it was 6 months.
I eventually got released.
Even after individuals get discharged from the hospital, similar threats from doctors keep them perpetually on psychiatric drugs. Doctors might even pit family members against one another to shame individuals into taking psychiatric drugs. Individuals are usually discharged on drugs, and those who wish to stop taking the drugs find their brains and bodies have become habituated to them. Virtually no services or supports exist in the community to help individuals titrate safely off psychiatric drugs. As a result, many experience withdrawal and rebound psychosis, landing themselves back in the hospital. And the ex-patient is blamed, not the system.
When I was discharged, I was discharged on 5 different neuroleptics.
I'm leaving the hospital, and of course, they wouldn't give me the bottle of medication because they said I was leaving against medical advice. So I'm not allowed to titrate off my medication. I said, fine, okay. And I went to do a total withdrawal, and I actually took a bus down to New York City to see an alternative psychiatrist to hopefully get into treatment right away. But while I'm there, I get a phone call that my children's custody has been removed.
I lost my job. And I lost all my friends. One of my kids, we lived with his father. It was just like that. The whole house of cards came tumbling down.
The latest involuntary treatment tool is forced outpatient committal, also known as assisted outpatient treatment, or AOT. Individuals living in their homes on an AOT order are court-ordered to get monthly slow-release injections of psychiatric drugs, or take pills and receive regular blood tests to indicate whether they are taking them. If an individual misses an appointment, he or she can be placed back in the hospital. In some cases, the police show up at the individual's home and escort them to the clinic for their psychiatric drug injection if they have not kept their appointments.
I had to report monthly at my local CMH, and they injected me. If I did not appear, they would have hospitalized me again.
As you can see, treatment is forced on people in multiple ways. Some would argue this is a necessary evil to help those who are unable to help themselves. In our next segment, we will explore how forced treatment might actually do more harm than good.